I think basically from what I can tell, you've had varicocelectomy, but I guess there are still symptoms going on. What's going on?
Yeah, when I did the varicocelectomy 3 years ago,
Yeah.
I wasn't well informed. I
Right.
thought it was a permanent fix,
Right.
but to my surprise, sometimes 6 months ago,
Right.
I started feeling the pain again. It started
Right.
recurring.
Right.
So I went back to my doctor. He
Right.
said they will have to do another surgery. And I was like, why
Right.
would you have to do another surgery if you did it before? That
Right.
means the surgery isn't a permanent fix.
Right.
Said, yeah, usually it will occur. And maybe they did it, they weren't aggressive in the first surgery. They need to be more aggressive now. And
Right.
I was a bit worried. What do you mean by being aggressive?
Right.
They said they need to take more some things out. I don't understand, but I
Okay.
wasn't convinced. So I just
Right.
left.
Right. That
And
makes sense.
I went online to
Yeah.
go and start researching and to get to know about it.
Yeah.
And truly, I learned online that the surgery is not it's not a permanent fix to it.
Right. Right.
So luckily, I came across your portal, and
Right.
I read through. I went through the testimonies,
Yeah.
and all those, and that made me to pick up my mind to give it a shot.
Okay. That's
And,
great.
Let's see how it goes.
Right. Yeah, it's very misleading to label varicocele surgery as a cure or permanent fix. It's not. It's a treatment for varicocele. Basically, it's just a treatment. What they do is they take the veins that are swollen and ligate them. Basically, they cut them, right? So now you don't have the swollen veins anymore, but what caused the veins to become swollen in the first place? The lifestyle, environmental, and pathophysiological risk factors, the root causes that made the veins swollen in the first place, there's no way surgery can correct those, right? How is surgery going to fix lifestyle? It can't. How is surgery going to fix environmental or pathophysiological risk factors? It can't. So what happens oftentimes is, number one, surgery in most cases, in about 84% of cases, it doesn't help improve fertility. It doesn't help improve pain symptoms, and varicocele develops in 5 to 10, 15% of the cases. So it's a treatment, but unfortunately it's sold as a cure right now.
Yes, you're right.
Yeah. So how can I help you today? Are you looking to start? Do you want me to give you a personal recommendation of the right treatments to start with? How can I help today?
I already ordered your full treatment.
Okay.
I ordered it on Monday.
Okay.
I ordered it with, I think, the Cyber Monday code. I got a 20% discount.
Right.
So, yeah, it came with books.
Okay.
I got the link, so I downloaded the books.
Okay.
And yoga sessions as well.
Okay,
Yeah,
yes.
so
Yes.
I'm going through them. And also I saw some, I think some tablets. I think those will be delivered.
Yes, they're being shipped. Yeah.
It's been shipped, so I'm expecting delivery of some of those.
Okay. Yes, I do see. I see your order. Yeah. Okay, that's great. So, I would actually advise one additional thing for you.
Yeah.
I highly recommend the Stud Briefs underwear. It's really, really helpful. It provides cooling and support throughout the day. It prevents any blood pooling. The blood pooling is really responsible for the pain symptoms, and it's just super great. It's probably one of our best products for just general testicular health and varicocele or any pain symptoms that you're having. I think if you add that on, it's going to make a really big difference. It's going to help out as well. And right now, again, the discount is still on, so if, I think it's a good deal right now. So I would recommend that for you.
Okay, I'll do that.
Yeah. And aside from that, do you have any questions for me? Is there anything I can help you out with right now in terms of your treatment, anything that I can do for you to help out?
No, I just wanted to be clear that I just want an assurance that there will be an improvement.
Oh, yeah, for sure. Well, almost all of our clients get complete pain relief with our program. So I think that's your number one concern. And your second concern is that the varicocele is going to redevelop. That's correct?
Yes.
Okay, so yeah, exactly. So basically, like I said, it's about number one, identifying the risk factors that are contributing to the disease, right? The risk factors, again, every case is different. We've identified 400 reasons why varicocele develops. So you have to read through the book and identify, okay, what are the risk factors that are contributing to my case, right? And from there, basically, you get an effective treatment for the risk factors that you identify. Now, if you wanted to, I do sometimes also provide additional service. I can do this for you quickly for free. If you fill out the varicocele risk assessment form, it's basically a detailed questionnaire to identify any testicular health and varicocele risk factors. And I can give you some quick feedback as to what is contributing to your case. Okay, I can do that for you. It's not a problem. I'll send you the link for that. I'll send you a link to the stud briefs. That way, at least you'll be off to a really great start. You'll get some great tips to get started right away. And, the pain relief should be coming very quickly. There's a pain relief chapter in the book. Read through that. You have the pain relief guide as well. Pain relief should be pretty easy and quick. And then identifying the risk factors. What are your main risk factors? Once you treat those, then you have almost zero chance of the varicocele redeveloping. There's no reason for it to redevelop. And I think, we get really, really great results for our clients. Even clients who've gone under surgery previously, we get really great results. So...
one more thing.
Yes.
I want to ask those exercises like push-ups and sit-ups.
They're fine. They're fine. Yeah.
Do they contribute to varicocele?
No, they don't. Not at all. There's also an entire chapter in the Healing Guide book on exercising with varicocele. So there's two different ways of looking at it, okay? Number one is, yes, there are higher risk physical activities for varicocele. Yes. But there are many ways of managing and minimizing the risk and making physical activity very therapeutic for varicocele and testicular health. Because, inactivity is actually much worse for varicocele and fertility than activity is. So it's really about managing the risk factors, the risk factor from exercising, if you're biking, for example, it's a saddle. The saddle hits your scrotum, hits your testicles, and you get micro trauma, right?
Okay.
That's one risk factor. Another risk factor is when you lift heavy weights, there's going to be increased pressure burden going down through your torso, and it makes more blood pooling happen. That way, better posture, better technique makes a big difference. As well, promoting posture as you work out, wearing the stud briefs underwear to provide support during the workout so that there's compression on the scrotum. So technically, you don't get that blood pooling happening, right? So there's lots of ways to minimize or zero out the risk completely and actually make exercising very therapeutic. And I think that the fact that there's so much misinformation out there on exercising with varicocele is kind of a sad thing.
Yeah, okay. I get it now.
Yeah.
Thank you very much.
Yes, that's good. I think maybe the best next step really is I'll give you that form. If you have any additional questions, you throw it in there and I'll answer all of your questions in there. And once you go through the risk assessment form, anything that you think is contributing to your case, include as much information as possible. And that way I can give you the best advice that I can. I'll look through it quickly and give you some really good tips right away. Okay?
Okay, that'll be fine. Then send the link of the...
Will do. 100%.
Okay, thank you very much.
Okay? All right, so have yourself a good rest of your day then. And yeah, stay in touch. If you have any questions, let us know. We're here to help, okay?
Okay, no problem.
So have yourself a good rest of your day. I'll forward you all the information now. Thank you.
You too.
Thank
Bye.
you. Thanks. Bye-bye.